Today's session on suprarenal gland or adrenal gland. Why this gland having two names? Suprarenal gland and adrenal gland. Supra means above, renes means kidney. If the gland present above the kidneys, that is suprarenal gland. In case of humans, it is suprarenal only because this gland is present superior to the kidneys. But in case of some animals, this gland will not be present exactly superior to the kidneys. It will be somewhere nearer to the kidney. Ad means nearer. Renes means kidney. Adrenal. Gland which is somewhere nearer to the kidney. Right? So that's what we are giving two names. Suprarenal or adrenal gland. Right? So this gland is present in the epigastric region, in the posterior abdominal wall, and it is retroperitoneal organ. Right? So we have to draw posterior abdominal wall to see the location of suprarenal glands. Right? Now I am drawing posterior abdominal wall, structures which are present in relation with the suprarenal gland. I am not going to draw all structures. Right? Structures which are present in relation with the suprarenal gland, those structures only we will try to draw and we will try to explain. So this is right crus of diaphragm, and in the middle you can find one arch like ligament. What is this? Arcuate ligament. Then what is this? Left crus of diaphragm. So this is left crus of diaphragm. Left crus is shorter than the right crus. Right? So here what is this ligament? Arcuate ligament. Behind the arcuate ligament there will be one opening. That opening is hiatus for the aorta. We can also call as aortic hiatus. So through that aortic hiatus, what is passing? Aorta. Is it? So here aorta. So this is aorta. Towards right side of aorta, what will be present? Inferior vena cava. So here we have to draw inferior vena cava. Inferior vena cava opening in the central tendon of diaphragm. So this is inferior vena cava opening. Imagine this is inferior vena cava opening. Through that inferior vena cava opening, inferior vena cava is passing from the abdomen to the thoracic region. So what is this? Inferior vena cava. I am removing this so that we can clearly see the inferior vena cava. On either side of the vertebral column, we can see kidneys. Is it or not? So here left kidney, this is right kidney. This is right kidney and this is left kidney. This is left renal artery and this is right renal artery. Of course renal veins also present. So this is left renal vein and this is right renal vein. So suprarenal gland present above the upper pole of kidneys. Is it? So now I am drawing right suprarenal gland. This is right suprarenal gland. Some part of the gland I am drawing with continuous line and some part of the gland I am drawing with dotted lines. Why? This part of the gland present deep to the inferior vena cava. So some part of the gland present behind the liver and some part of the gland present behind the inferior vena cava, and this gland is triangular in shape or pyramidal shaped gland. But in case of left side, it is not pyramidal shaped structure, it is half moon shaped gland or semilunar shaped gland. So this is semilunar shaped gland. Is it? So this is left suprarenal gland and this is right suprarenal gland. We will take these two structures here to show different features. This is triangular in shape. That's what it shows, apex and base. So this is apex, this is base. This is what? Left suprarenal gland. It is semilunar in shape. That means it is half moon shaped gland. That's what it is having, upper end and lower end. Right? Then what are the measurements of it? If you take the length, it is around 5 centimeters or 50 millimeters. 50 millimeters. Width 30 millimeters. Thickness 10 millimeters. Weight 5 grams. Is it? Then these glands are surrounded by capsule. There will be a true capsule and false capsule. True capsule is nothing but condensation of connective tissue of that particular gland. Is it? So that is true capsule. If you take capsule, we have to take along with kidney. This is section of kidney. This is kidney. Over the kidney, we can find suprarenal gland. So this is suprarenal gland. Kidney surrounded by renal capsule. Is it? So this is renal capsule or renal fascia. This renal fascia, after covering the upper pole, it fuses and separates the kidney from the suprarenal gland. Then it resplit and covers the suprarenal gland also. At the upper part of suprarenal gland, these two fascia, that means these two layers of renal fascia will not fuse, so that this perirenal space will be continuous as bare area of liver in case of right side. In case of left side, this space continues as subphrenic extraperitoneal space. Right? In case of right side, bare area. In case of left side, subphrenic extraperitoneal space. Is it? In between true capsule and false capsule, there will be accumulation or deposition of fat. That fat is perirenal fat. Right? So that is about covering or capsule. Now we will see what are the different presenting parts and what are the different relations. It is triangular in shape, so that it is having apex, base. It is flattened from anterior to posterior side. That's what it is having, anterior surface and posterior surface. If it is having anterior and posterior surface, definitely there will be borders. So this is medial border, this is lateral border. But anterior surface will shows one vertical ridge. That ridge will separate the anterior surface into medial part and lateral part. That ridge, what we are calling anterior border. Right? Within that anterior border, we can see the hilum of right suprarenal gland. Through that hilum, right suprarenal vein is emerging. Right? That we will discuss. These are the presenting parts of right suprarenal gland. About left suprarenal gland, we will discuss. Let me complete the right suprarenal gland, presenting part and relations. If you take right suprarenal gland, apex is related with the bare area of liver. I am taking visceral surface of liver to show the relations of suprarenal gland. Here, this is liver visceral surface. Here you can see fissure for the ligamentum venosum. This is fissure for the ligamentum venosum, and this is porta hepatis, and this is gallbladder within the fossa for the gallbladder. And here one more fissure will be present. That fissure is fissure for the ligamentum teres hepaticus. This is fissure for the ligamentum teres hepaticus. And here one fossa will be there. What is that fossa? Fossa for the inferior vena cava. This is inferior vena cava. And here renal impression. Here gastric impression. Here duodenal impression. This is second part of duodenal impression. Here renal impression will be present. Is it? So I am drawing renal impression in dotted lines. This is renal impression. Is it? Of course, here bare area is there. Bare area means the part of the liver not covered by peritoneum. This part, right? So this is bare area of liver. Clear? So over the upper pole of right kidney, we can see right suprarenal gland. So this is right suprarenal gland, right? So this right suprarenal gland related with inferior vena cava and right lobe of liver. But now we are discussing about apex, is it? So apex, see this is apex. Apex is related with bare area of liver. That's it. Then base, see this is base. Base is related with upper pole of right kidney. Over. Apex related with bare area of liver. Base related with upper pole of right kidney. Then anterior surface and posterior surface relations we will see. Anterior surface divided into medial and lateral part by one vertical ridge that we discussed. So medial to this vertical ridge, this part is related with inferior vena cava because part of the right suprarenal gland present deep to the inferior vena cava. So this part is related with inferior vena cava, right? Then this part is related with right lobe of liver. So here right lobe of liver. So this is liver or hepatic area. This is inferior vena cava area and this is hepatic area. That's it about the relations of anterior surface. If you remember these two structures, that will be sufficient. But occasionally here we know that superior duodenal flexure. So this superior duodenal flexure will be related here. That means you have to remember three structures: inferior vena cava, liver and superior duodenal flexure, right? Otherwise remember simply these two structures, that will be sufficient. Anterior surface related with inferior vena cava and liver. Then posterior surface. See, posterior surface related with right crus of diaphragm and kidney. Which kidney? Right kidney. I am taking posterior surface of the kidney along with suprarenal gland. This is right kidney. This is left kidney. This is right suprarenal gland from the posterior view. This is right suprarenal gland from the posterior view. This is left suprarenal gland from the posterior view. So posterior surface of the suprarenal glands divided by arched line. See, this is one arched line, this is another arched line. This arched line dividing the posterior surface of the gland into upper part and lower part. Upper part related with crus of diaphragm. In case of left side, left crus of diaphragm. In case of right side, right crus of diaphragm. So this is diaphragm. This is diaphragm. Which part of diaphragm? This is right crus of diaphragm. This is left crus of diaphragm. Right? So here this area related with right crus of diaphragm. This area related with left crus of diaphragm. That's it. Then this lower part is related with kidney only. So right side right kidney, left side left kidney. So remember very simply, posterior surface of the right suprarenal gland related with diaphragm. That means right crus of diaphragm and right kidney. In case of left side also same, left crus of diaphragm and left kidney. So that is about posterior surface relations. Then relations of medial border, relations of lateral border. See, this is medial border. Here celiac trunk is there, is it? And here one ganglion will be present, here another ganglion will be present. What are these ganglions? Celiac ganglions. So this is right celiac ganglion and here left celiac ganglion. So medial borders are related with celiac ganglions, right? Then laterally, see this, laterally what is there? Liver only. In case of right side, laterally liver, right? So here liver. Clear? So now we completed relations of right suprarenal gland. Apex, bare area of liver. Base, upper pole of right kidney. Medial border, celiac ganglion. Lateral border, liver. Anterior surface, inferior vena cava and liver. Posterior surface, right crus of diaphragm and right kidney. Then we have to discuss about anterior border. Within the anterior border, you can see hilum. Through this hilum, there will be opening of one vein. What is this vein? Right suprarenal vein. This right suprarenal vein will be directly opening into the inferior vena cava. That we will see in the venous drainage. Right. So this is about presenting parts and their relations of right suprarenal gland. Then left suprarenal gland. It is having upper end, lower end, medial border, lateral border, anterior surface and posterior surface. Now upper end is related with one structure which is present here. What is this? Here one structure will be present. What is this? Spleen. Is it? So upper end related with spleen. Then lower end. It is related with left renal vein, but at the lower pole it contains hilum. Through that hilum, left suprarenal vein is emerging and opening into left renal vein. So here there will be emerging of left suprarenal vein. Then anterior surface relations. By one transverse ridge, anterior surface divided into upper part and lower part. So this is upper part, this is lower part. Clear? This upper part related with stomach. This is one of the stomach bed structure. Is it? So here stomach or gastric area. Below that pancreas will be passing like this. Is it or not? Towards the spleen. So this is pancreatic area. This is pancreatic area and this is gastric area. Clear? So anterior surface related with pancreas and stomach. Then above the pancreatic area you can see splenic artery. So these are the anterior surface relations. Anterior surface related with stomach, pancreas, splenic artery. Then lateral and medial border relations. Lateral border related with what? What is this? Upper pole of left kidney. Is it or not? So upper pole of left kidney and stomach. Then medial border related with what is this ganglion? Celiac ganglion. That's it. Now we will see posterior relations. We have already discussed posterior surface related with left crus of diaphragm and left kidney. Upper pole of left kidney and left crus of diaphragm. Right. So these are the posterior surface relations. So these are the relations of right and left suprarenal glands. I will not repeat because these are very easy. If I repeat, you will feel bored. Now we will see what is blood supply. Arterial supply you will see separately, then venous drainage you will see separately. First if we take arterial supply, see this is aorta. Below the diaphragm it gives one branch on either side, right and left inferior phrenic arteries. What are these? Inferior phrenic. So here also inferior phrenic. Otherwise let me take separate diagram so that you can understand. I hope you understood the relations. I am removing this. I am taking the aorta. So this is aorta and here right suprarenal gland and this is left suprarenal gland. This is left inferior phrenic artery. This is right inferior phrenic artery. This is middle suprarenal artery. This is middle suprarenal artery. This is also middle suprarenal artery. Right side. And what are these two arteries? These are right and left renal arteries. So this is left renal artery and this is right renal artery. Suprarenal gland is supplied by one direct branch from the aorta. What is that? Middle suprarenal artery. See, this is middle suprarenal artery. It is direct branch from the aorta. This is middle suprarenal artery. Then suprarenal artery from the inferior phrenic. This is suprarenal artery. It is from the inferior phrenic. So what is this artery called? Superior suprarenal artery. What is it? Superior suprarenal artery. So here also superior suprarenal artery. Then inferior suprarenal artery. Inferior suprarenal artery is branched from the renal artery. So it is having triple blood supply. Three arteries are giving: superior, middle and inferior suprarenal arteries. Superior suprarenal artery is branched from the inferior phrenic artery. Inferior phrenic artery is branched from the aorta. Then middle suprarenal artery is direct branch from the aorta. Then inferior phrenic artery is branched from the renal artery. Right? So that is about arterial supply. Then venous drainage. In case of arterial supply, three arteries are there each side. But in case of venous drainage, only one vein is there. That vein is suprarenal vein. I am taking the venous drainage here. This is inferior vena cava. This is renal vein. This is left renal vein and this is right renal vein. Right? So I am taking this gland here. If you draw exactly, it will be like this. I am taking the cut section. From the gland, vein is coming like this and it will be opening into inferior vena cava. Right? So which vein is this? Right suprarenal vein. Right? Suprarenal vein. Then left suprarenal vein is not opening into the inferior vena cava. It is opening into left renal vein. It is opening into left renal vein. So this is venous drainage. Right suprarenal vein opening into inferior vena cava. Left suprarenal vein opening into left renal vein. Lymphatic drainage, para-aortic group of lymph nodes. That means lymph from the suprarenal glands drains into para-aortic group of lymph nodes. Then nerve supply. Sympathetic innervation by T8 to L1. If you take the cut section of spinal cord, in case of thoracic region and upper lumbar region, you can see lateral horn also. Along with anterior horn, posterior horn, there will be lateral horn also. Nerve fibers will be arising from the lateral horns in case of sympathetic nervous system. So this is preganglionic nerve fibers. So these preganglionic nerve fibers enters into anterior root and reaches to the spinal nerve. When they reaches to the paravertebral region, they reaches to sympathetic chain. In the sympathetic chain, there is 4 chances actually. One chance is these preganglionic fibers will terminate here and postganglionic fibers will be arising at the same level. But in some segments, these preganglionic fibers without relay, they ascends up or they descends down and they relay in the upper ganglion. So they will relay here in the upper ganglion and postganglionic fibers will be arising from this ganglion. Right? They may descend down and they may relay in the lower ganglion and the postganglionic fibers will be arising from there. In some other case, preganglionic fibers will not relay in the sympathetic chain. They will relay in the ganglions which are present in relation with the organs. Right? So if you take that nerve, imagine this is preganglionic nerve fiber passing through the anterior root and pass through the sympathetic chain. But they will not relay here. They comes out as splanchnic nerves. They comes out as splanchnic nerves and they relay in the ganglions which are present in relation with the viscera. Examples are celiac ganglion, renal ganglion. Right? So they relay here and postganglionic fibers arising from here and reaches to the target organ, right? But in case of adrenal medulla, there is no postganglionic fibers. There is no postganglionic fibers. These fibers, that means these preganglionic fibers, are directly going and terminating or supplying the adrenal medulla. It is supplying to the adrenal medulla. Imagine this is cortex, this is medulla. So they are terminating within the medulla. What I am trying to say is there is no postganglionic fibers for adrenal medulla, right? But these postganglionic fibers are supplying to the blood vessels of adrenal gland. So that is about nerve supply. From where? T8 to L1. Actually, to make it understand, I told all these things. Otherwise, simply remember that preganglionic fibers from the T8 to L1 segment supplies to the adrenal medulla. Adrenal medulla is directly under the control of sympathetic division of autonomic nervous system. This is about gross anatomy. Now we will discuss about histology after break.